Hey there! Today, we're breaking down what a benign tumor actually is. All right, here's the game plan. We'll cover what they are, the causes, and what happens next.
Okay, finding a lump is, scary. But what does benign actually mean?
So, here's the key thing to remember. A benign tumor is not cancer.
Think of it like this. Benign tumors grow slow and stay put, totally different from malignant ones. So, what even causes them? Well, we don't know for sure, but some factors do play a part. Yeah, it can be anything from genetics and environment all the way to diet and stress.
A lot of the time, you won't feel a thing, but if it gets big, that's when problems can start.
So how do doctors know for sure? It's a really careful process to get that final answer. It usually breaks down into 3 main steps: a physical exam, imaging, and then a biopsy. Things like MRIs and ultrasounds give doctors a super detailed look at what's going on inside. And this tech is crazy accurate. Ultrasounds, for example, are almost 96% sensitive in spotting lesions.
And now get this. AI is getting in on the action, making diagnosis even sharper.
Basically, you train these AI models on tons of images, so they learn to spot the difference. The whole point is to give doctors a super reliable second opinion. It's a real game changer. But the definitive answer, that almost always comes from a biopsy and its pathology report.
Those reports can be confusing, right? So let's look at 3 key terms you'll want to know. First up, tumor grade. It's basically a score for how weird the cells look compared to normal ones. Then there's tumor margin. This just tells you if they got the whole thing out during surgery.
And mitotic rate? That's just a fancy way of saying how fast the cells are growing. So, you get a benign diagnosis. Does that mean surgery? Well, not always. It really depends. Usually, it's one of 2 things. Either watchful waiting or surgery if it's causing trouble. Right, so this basically means if it's small and not bothering you, just watching it is often best. The most important part is just keeping up with your regular checkups to track any changes. So, what's the big takeaway? The more you know, the more you're in control. Ask questions.